Now, President Ruto has defended plans to establish an Ebola preparedness facility at Laikipia Air Base. He said the facility will strengthen Kenya's capacity to respond to future disease outbreaks, and he dismissed criticism of the project and urged leaders not to politicize public health issues. He was speaking during a roundtable interview with journalists from Northeastern region at Wajir State Lodge on June 1st, 2026. That was yesterday. He maintained that the government is taking responsible steps to prepare for potential health emergencies. Let's listen in again to that bite of President Ruto speaking on our Ebola preparedness and generally our collaboration with the United States on matters health.
We have many partners. I will give you an example. We've had the challenge of COVID before. We now have the issue of Ebola. But I want to assure this nation that the government of Kenya has made adequate arrangements. We have deployed every arsenal that we have to make sure that we protect Kenya, that we deal with the challenge. We have made preparations for isolation units, for surveillance, for treatment. In 23 counties, we have activated different mechanisms, and different hospitals have been already set up to make sure that if there was a case of Ebola in Kenya, we would know what to do with it. As I talk to the country this evening, we are screening every day any visitor who comes to Kenya. All our borders are on high alert. All our borders, land borders, air borders are already activated. There is surveillance, there is screening. On average, we screen close to 3,000 people every day.
Okay. Again, talking about our preparedness, our previous collaborations, but I'm not hearing much about the flesh of this deal. You know, we know where it falls under. It's under an extended agreement that already existed. But what are the exact conditionalities of this, right? Is it Americans we're hosting, or is it also open to Kenyans? Are we doing this for there's a court order stopping? Are you halting in respect of the court order, or are you continuing regardless of a court order being there? Those are some of the things that are just not coming out for me.
Clarity. Even, for me, even these are the 23 county facilities and all, because I am sitting here looking at what we just did, the first one. The WHO is actually saying this thing is getting out of hand. It's basically running ahead of all of us that we're trying to contain it. It's running ahead of all of us. It's crossing over from DRC. It has come all the way into Uganda. We share a border with Uganda. And we have people who travel across this country into Uganda, into the eastern DRC, right? Now, the president is talking about all those, counties along that entire northern corridor having surveillance and facilities. Are they actually there? Are they really there? When we say the airport, and we saw PS Mary Modoni saying, at the airport we've set up, people who are coming from these particular areas, they're using a separate, terminal and gate all together, so they go through heat screening and all. But to what extent are we actually doing this contact tracing, testing and verification of whether this is the virus? Because even in the DRC, that's a challenge they're facing. They cannot immediately just tell that this is this particular strain of Ebola virus. They have to take the samples to a separate facility, and then it takes some time for the results to come back when somebody is actually quarantined here. So are we saying that the people who are arriving from across the borders are first of all going into some level of quarantine, or in some level of follow-up at community health level, where they know if Felaris you've just crossed over, you are in Uganda, you are in this particular region of Uganda, so go and quarantine yourself or isolate yourself, and there'll be a local health personnel who will be checking up on you, and so on and so forth. I mean, are we doing any of that, or are we just saying we are setting up places?
Yeah, or even looking at how maybe there could be an element of feeling like, okay, since we managed to manage COVID in this way, then maybe using the same framework would be able to manage this. And it's a case of recognizing that we're dealing with two extremely different situations with two different levels of extremities that require a certain kind of sensibility that trickles down to community level. I mean, we did see the doctor that was evacuated from the DRC and taken to Germany. So question there becomes, had the facility here been set up, would he have been brought here? What would that have looked like? I think one of the things I really need to understand from P.S. Oluga is, give me a demonstration. If a case is reported in Busia right now, how is it going to be handled from initial contact down to how that person is going to be treated in a facility? Walk us through that process, because the information gaps that we've all pointed to is what needs to be addressed, but not just on a top level. It needs to be so granular that Kenyans feel confident that we can manage this.
Very true. And that we even have an understanding of how the disease spreads, the basics. Prevention, if possible, where to go, right? Is this one of those things where I start from my community health promoter to the dispensary? Or is this, if I suspect, I've been in contact, is this straight to a level 6 or a quarantine? There's still so much information that is lacking.
There's a lot. A lot.
Or are we just treating it like, the last time? I mean, we've had COVID, not COVID, but we've had Ebola outbreaks in these countries before. It has never become a big issue here. If you bring it to a big issue here, you spread panic. What are you calling for? Are you calling for, starting to lock down some areas? So what does that affect economic activity? Will people understand it? But I think it just comes to information. If the government does not communicate well, it just goes into everything will be mishandled. If the one case of Ebola is announced today, there are quarters who will start saying, but we told you, so that they get the 1.7 billion shillings, what are announced case moja Ebola to justify. There are people who will be like, hakuna Ebola, hii ni ile pesa ya Trump na wanataka. All right? There are others who will be like, kuna kesi ya Ebola. Okay, sawa. And move on with life. Okay. And others will be like, kuna kesi ya Ebola. Panic.
Well, there's already panic right now.
Yeah. There are different people who will react in different ways should there be a case of Ebola. The thing is always that flow of information, and a government that appears to want to carry its citizens along, and one that doesn't want to carry its citizens along. This one doesn't want to carry its citizens along, and not just this one, even the previous one. I said yesterday, COVID, it's God. It's not because the same things we're talking about, isolation facilities, they were not there.
They were not there.
We just had places where I say, that's the school, it's an isolation facility. Governors saying we want more money so that we can buy more beds. Others saying we have diverted our budget so that we can put,
manage COVID.
To manage COVID here. And it just wasn't. Others who are now selling PPEs at exorbitant prices and so on. COVID billionaires never ended. So there's a lot of mismanagement that happened then. And we were lucky that at least we say it didn't come to that extent, not like what we saw in other parts of the world, in Brazil or in Spain and Italy or in China itself.
That's